Okay, so welcome back to Navigating Medicare with Confidence. I'd like to introduce our first guest, Annie Crivello, who is a licensed Medicare insurance advisor. And I'm going to let her continue with the introduction herself. So, yeah, take your mic. Is it on? There you go. It's on. Yeah, it's on.
Hello, everyone. It's not fair because I'm truck of police. So my name is Anne Cravello. I'm from Brazil. I came to U.S. 10 years ago, and I landed in Central Coast. And after the passing of my husband, I took over the business. And here, my office is in Santa Maria in Santa Maria, of course. And I would like to thank Nancy for this opportunity. I'll be here to answer the questions you might have about Medicare. And as I mentioned, I'm from Brazil, I speak Portuguese. And some words you might have a little problem to understand, so just ask me again. Thank you.
Just ask again, but she doesn't miss a beat with the insurance. She's my insurance person. So, okay, Annie, I'm going to ask you a few questions. What would you say is the biggest misconception that you hear about Medicare?
Well, first of all, everybody thinks Medicare covers everything, and it doesn't. Sure. Medicare doesn't cover drugs, medication. Medicare doesn't cover dental, vision, and that's why it's important to add, when you sign up for Medicare, you add supplemental plan or advantage plans. Another misconception is that Medicare is free, and it's not. If a person doesn't contribute during 10 years, they need to pay for Part A, which covers hospital, and they also need to pay Part B. Part B, everybody needs to pay for that.
Right. Okay, so can you explain the difference between original Medicare and Medicare Advantage? We hear a lot about Medicare Advantage, and they do a lot of advertising about it. But I do know that for me, for instance, it's not the right choice. So it's really important that you talk to Annie or your insurance person who has a clear understanding what it will and won't do for you. So what would you say is the difference?
Okay. Regional Medicare is funded by the government. And Medicare Advantage is administered by private companies. Sometimes people, like you said, think the Advantage plan is not a good option. However, it depends on the person's situation. If a person takes medication that it's very expensive, sometimes the option they have to save money, it's getting Medicare Advantage. But we have PPO plans that have the flexibility to use it in and out of network. So it depends on the situation.
Okay, so your choices are limited with Medicare Advantage, although in some cases it might be a good fit for you, but there are limitations.
Yes. So every person has a different situation. So we cannot generalize if it's good or not. It depends. Yeah.
Okay, good. Okay, so what are some common mistakes that people make when they're first enrolling?
Okay, one of the biggest mistakes, going back to the first question, is thinking Medicare covers everything. Medicare covers 80%. So, and there is no cap. There is the 20% that needs to be covered. And the 20% sometimes can be a lot. For example, if a medical bill is $1 million, Medicare will pay 800, but 200 the person needs to pay.
So Medicare will pay 800,000 and you pay 200,000. Yeah, I just would write a check, right?
Yeah.
Wow. Yeah. You know, it's we don't have any magic bullets here, but it's a lot easier to know what you're getting into when the crisis happens. Our mission at Seacoast Seniors is to help older adults and their families make knowledge-driven decisions versus crisis-driven decisions when the crisis hits, because the crisis will eventually hit. And if you have to start from square one, you and your family members are going to be freaking out. I can't think of a better way to put it. And tell them to call me anyway, and I'll try to get you guided in the right direction. But it's so much better if you at least have a working knowledge of this information. So, well, how do you know which plan is right for you? And what factors?
Yeah, it depends on the person's situation, the health condition, the financial condition. Everything is going to be important when make a decision, the right decision.
And you sit down with people and assess and take the time needed to help them figure it all out.
Yes, and I used to say that there is no dumb question. Every question is important because even me, that I've been studying this every year, I've been updating about everything. It's important to have the questions answered, to not make mistakes. Yeah. And I keep my phone available. I don't have personal phone anymore. I have 2 lines, and it's almost 24 hours because I have people calling me Saturdays and Sundays. And I think it's important to know what's going on with their insurance.
Mm-hmm. And, not all, would you agree that not all insurance agents know anything about, know enough about Medicare to truly help their client?
And that's another thing that it's important when you are turning 65, start to make some searches and go to a person that has experience and knows more what they are doing than about commission.
And I know when you arranged my Medicare supplement and supplement policy, I had questions that kept coming up for a week or two afterwards. So I'm texting her and calling her, and she answered every question and calm me right back down. So, and another thing is I had a wonderful insurance person for years, Jamie Clark with State Farm. And Jamie got ill and he had to close his business about, it's at least 10, 12 years ago. And he turned his business over to another excellent insurance agent in town. But that insurance agent told me right out the gate, I don't do Medicare. So it is important, no matter how loyal you are to your insurance person, and we love people that are loyal, make sure that you got the right coverage. And I don't know about you, but as I get older, a lot of my professional contacts are retiring. They're either retiring or dying on me. And so if that turns out to be, your case, be sure you hold on to Annie's phone number. Okay? And don't ever lose my number, because if you lose Annie's, I'll always be able to hook you up.
Another thing is I've seen some insurance agents who sell car insurance, home insurance, and they help people with Medicare just because they are clients and they want to help them. But they are not trained, so they don't sell Part D. And the Part D, which covers medication, it's you need to be trained and licensed to sell it. And if you do not have, you pay penalty. So I have people coming to my office, they first sign up For Medicare, they didn't add Part D because they were not taking any medication. And 10 years later, the health condition hit them and they need to have expensive medications. And they are paying more than they are supposed to because they have penalty. They have to pay penalty.
The other thing that I'd like to interject is Jamie set me up with my Medicare and I just cruised with it for years, never considering that it was a good idea to have my insurance reviewed during open enrollment. So one day the light bulb went on. I've always been a slow learner. And I called Annie, and after meeting with her, my monthly obligation went down about $500 a month. And I don't know how many years I unnecessarily paid extra and wasn't even getting the same coverage anymore. So these insurance companies are very fickle in what they offer and how much they charge, and it changes all the time. So it's very important to review your Medicare insurance during the either before or during the enrollment period, because when is the enrollment period over?
Oh, the enrollment period, we have October 15 to December 7 for Medicare Part D and Medicare Advantage plans. If a person has supplemental plans, if they are not healthy, it's during their birthday. It's 30 days before and 60 days after their birthday. And if their health can be all year round. You mentioned... Oh, another thing that I think it's important to say. When a person has supplemental, they have Medicare as the primary. So it's not the supplemental plan that is good. I have people coming to my office and they say, oh, my plan is wonderful. I don't want to change. No, Medicare is the primary. If Medicare doesn't pay, it doesn't matter if you have Anthem, Blue Shield, Health Net, they will pay if Medicare pays. So it's worth to review their insurance. And by law, all the insurance companies, they need to offer the same basic benefits, no matter where you live and which insurance company you choose.
Wow, is anybody confused yet? Medicare really confuses me, and that's why it's so important to surround yourself as you build your aging journey with people that you can depend on. And the people that we bring to you to our workshops are people that you can depend on. They are the guys in the white hats. And, there is an organization, and I'll give you the phone number at the end, and it's called HiCap. And they will, free of charge, sit down and explain to you what Medicare, how it works and what your options are. They will not advise you. It is a free service, but it is 100% do it yourself. And if you're even a tiny bit confused, you need a professional to walk you through it. Because you can't say to the HiCap person, I chose this, this, and this, and this is going on in my life. They will tell you that we can't advise you one way or the other. So it's pretty scary, but it is a free service if you're a diehard do-it-yourselfer that is available to you.
Yeah, and just adding, HiCap leads you to the right plan, but they are not allowed to enroll you. And I would not recommend to enroll by yourself, because if something coming up, you need an agent to help you. So HiCap cannot do it because they have their limitation until which point they can go. And that's when the insurance agent comes.
That's a really good point. So yeah, you might get yourself enrolled, but if it hits the fan 6 months down the road and you need some help and guidance, you're on your own. So that's another excellent reason to have an insurance person
And there
that's
is no
local.
extra fee to have an agent.
No.
So it's just you know where to go, who you can count on. Yeah.
And part of the reason you do this is part of the reason I do this is because it breaks our heart when we see so many situations, crisis situations, where that could have been avoided, and it's too late to fix the problem. I mean, we could try to do the best we can with what we have to work with, but it's unbelievable out there. Nobody knows what they're doing. There's no provision to help older adults in this country, support-wise. And so Seacoast Seniors, we are the only people on the Central Coast that are doing what we do. And there aren't many insurance people that really have a heart for families like Annie does. So just keep that in mind. Can you give me an example of a situation where someone saved money by choosing the right supplement or advantage?
I have two situations in my office. One of them, the husband came to sign up the wife. And when I finished, I asked him, what do you have? Oh, I have A and B and I'm good. And I said, no, you cannot. We come again back to the first question. So I said, well, for $100, you can add something and you can be protected. And he said, okay. 2 weeks later, he needs to do an open heart surgery. And he said, when he finished the surgery, he was in the room. The first person he thought about was me. Because he saved a lot. He didn't need to pay. He didn't need to pay any extra for his surgery. And he saved a lot. And for Advantage plan, I have people, the good thing about the Advantage, you have a 12-month free look. And I have people who are in a financial harsh, and they came to me and said, Annie, I'm paying like $300, $400 a month for my wife and I, and we are in good health. And I said, well, you can have 1 year to save that money, and then you go back to what you had before. And that's what they did. And they saved more than $4,000. If they need the plan was there for them. Their doctors were in network, so they didn't pay to see a doctor. The lab exams was also free. So the annual checkup was free, so they didn't spend any money, and the plan was $0 in that time. So they spent a year without spending anything. So it was a good save for them.
You know, one of the things I like about Annie is she almost acts as if she's the one that's going to be writing the check. You know, she takes your situation very personally, and I love that about her. What should people turning 65 do right now to prepare?
You know, first they need to be careful about the time frame. So they have a window 3 months before their birthday, the month of their birthday, and 3 months after to sign up for Medicare. And after that, do not think it's over. They need to add supplemental or advantage, and do not try to do by yourself. Try to find somebody that can help.
Okay, great. And what about those people that are still working? Do they still need to enroll in Medicare?
Yes, and I have somebody talking to me here today. I don't know where she is, but it depends of the size of the employer. If they have up to 20 employees, Medicare, they need to sign up for Medicare. Medicare will be the primary, and the company will be the secondary. If it's more than 20, Medicare will be the secondary, and the company will offer the insurance. So the HR department is going to answer what is the if they need to sign up or not. And if they sign up, it needs to be a credible insurance. It needs to cover medical and prescription drug plan.
Okay, so that's if you're an employee.
Right.
What if you're someone like me who turned 65 a long time ago and I'm self-employed? So do I still need to sign up, someone like me sign up for Medicare?
Yes. And when you are self-employed, if you have contributed to Medicare more than 10 years, you are going to pay only for Part B. And I have a situation, person was self-employed all her life, and she didn't contribute at all. Now she needs to pay for A and B. And it's a lot. It's almost $700 for both.
They probably did their taxes themselves. because a good accountant wouldn't have let them do that. Oh my gosh, wow. Okay, that's a good one. I'm always learning at these workshops. You think you're learning? I learn every single time. So what changes are people allowed to make during open enrollment?
Open enrollment, okay, first I need to explain. We have enrollment periods. Everybody says open enrollment. What we have is an annual enrollment, which runs from October 15 to December 7. And that period, I think it's the one that you mentioned,
Yes.
We review the Part D and Medicare Advantage.
And the Part D is the prescription.
Prescription drug plan.
Right.
Then we have special enrollments when when there is a catastrophic event in the area, like we have the fire. So FEMA established that it's a special enrollment, and a person can also review their plans. We have the open enrollment when a person turns 65. It's the initial open enrollment for them.
Okay, great. I'm just calling you if I need some clarification on that. Okay, and last question. How can someone tell if it's time to switch their plan?
It depends of the financial situation. If the plan supplemental plans, it's age attained. So every year a person has two increases. One is the year increase, another one is for the age.
That's the year, not the ear. You're so cute with that accent.
And
I'm sorry I interrupted you.
I mentioned that.
How can someone tell it's time to switch their plan?
Yes. When it comes the enrollment, the annual enrollment, if their Advantage plan or the prescription drug plan are not covering all the medications they have, it's time to change again. It's always time to review, because every year they change their formularies. So 1 year you can have your prescription covered, next year it's not covered anymore. So pretty.
And you shop plans all over the United States, and I know when I signed up with you, you were also checking prescriptions in Canada.
Yes.
So she's very resourceful.
Sometimes there is no perfect plan, and sometimes the prescription drug plan doesn't offer the coverage that the person needs. So one of the options, even with the tariffs now, Canada is still good. And some doctors send the prescription to them, and they send the medication to the doctor's office or to the person's house. And the...
I lost a little. Sorry.
That's okay. That's a good that's a great answer. You answered it pretty fully, and it'll come back to you later, and you'll either share it or we can do it during the Q&A. But thank you so much, Yanni.
Thank you so much for your attention.
All right. So our next guest, Alexandra Morris, who we fondly call Alex. Alex is going to introduce herself to you, and then we'll get going from there.
Okay, perfect. First, let me start by saying thank you for having me, and for holding this lovely event. And what a good-looking group. So I'm a geriatric care manager, and I've been doing this work about 30 years. I can hardly believe it myself. Well, a geriatric care manager provides a holistic approach. So when we're hired, we go in and we do an assessment and care plan, and we look at every part of your life, the medical, the health issues, the caregiving situation, your home environment, your spiritual beliefs, your values, your hopes, your dreams. We look at everything, and we create a detailed report. Oh, including family. That's really important. We create a detailed report, and then we include in that report not only our findings, but also resources. We provide resources to other professionals that are standing in this room, and to government and to nonprofit organizations as appropriate. Also, we provide resources. For example, if I notice things in the home that concern me, yesterday I did an assessment, at least started it, and I recommended a different kind of walker. The walker that the man had in the environment that he lived, because the flooring I feel was dangerous. And they have a glass door on the shower, and the shower's not that big. So the chance of falling through that glass door are not small. So those just two of my recommendations. Also, what we do is we coach. So if you're having family difficulties, let's talk about that. If you're having someone in your life with neurological condition, let's talk about how to communicate well with them, and just in general have reasonable expectations. And we kind of, if you allow us, we follow you. So we do the report, provide these resources, and then after that, often monthly or every other month, I'll go in, or if someone's in the hospital or the ER or whatever, is I will tell you exactly what I think, and I will advocate for you. Is that clear? Okay, that's what I do.
Yeah, and all of you want to hold on to Alex's number, because right now you're very proactive. You're here today, so that tells me a lot about you. Things could change tomorrow, right? One fall can change the whole trajectory of our lives. If you are blessed to have family, no matter what the relationship is, it's not a bad idea to give them Alex's phone number now, because when it happens and you need help, you want to give them my phone number, but Alex is a great number to also have, because if you start getting a little, you know what I'm talking about? If you start getting being difficult for the kids to help you by being stubborn and the like, the kids can call Alex and suggest some ways that you both can communicate better. I can't think of a more tactful way to put that. If anybody has another way, please raise your hand and tell me what it is. But I have noticed, I've been working and focusing on working with older adults and their families now for 7 years. And it's incredible to me how stubborn people get as they get older. It's like nuts, and some of those people are in this room today. I'm not going to make any eye contact, but I encourage you to make some good decisions now before you cross the line and get into that weird mode of stubbornness, where to the point where, like my mother would say, you'd bite off your nose to spite your face. Just the answer is just no matter what. No. And we have a lot of people that need care. I have adult children call me all the time. I had one yesterday. I was on the phone with her for over an hour, and they've had like 5 or 6 caregivers come through the house, and she fires every single one of them because she won't. She said nobody can do it like her. Well, but she's not taking care of Dad, and Dad needs help with his bathroom needs, and she's not doing it. And the adult child is absolutely beside themselves. So please don't do that to your kids. Start thinking about these things. You're not always going to be the person that you are today, unfortunately. There's a possibility that you might not be, is probably the best way to put it. Don't get me going. I'll hijack the workshop.
Sorry that, because then you just led into exactly what I do. Is I work with families. So thanks.
Yeah. That's why, a lot of people don't think they need a geriatric care manager, also called a life care manager, but she is worth every penny that she charges, which isn't that much. We're going to have a Q&A session at the end. This is Alex Morris, Morris. We're going to have a Q&A at the end, and after the workshop is over, both speakers are going to stay a little bit longer. So if you have personal questions or questions that didn't get answered, you can talk to them then. So, Alex, how is your role different from that of a Medicare insurance agent?
I don't sell insurance.
Yeah.
What I do is I refer to experts. I know there's things I just don't know. I'm not a legal person. I'm not an insurance person. I'm not a doctor. I know a lot of stuff, but I don't know everything. So I connect people to the proper resources.
And you also have an extensive background with Alzheimer's, right?
I do. I work for the Alzheimer's Association as their lead trainer for well over 20 years. And have also worked in a variety of other settings. I was a long-term care ombudsman. I ran an adult daycare center. I ran the camp for brain injured adults and an adult daycare center. So I have lots of experience in that regard.
Yeah. So Medicare can be confusing. Where do you see people get stuck?
Well, I see folks, as you both said, and I agree, by the way, with everything that you both said. A lot of times they think it's free. A lot of times they get taken by surprise, by share of cost. I call them deductibles. I learned that its proper term is share of cost. They get surprised when the 80-20 thing, that they didn't sign up for the secondary, and now they're ill. I even thought, and I have done this a long time, I went to high cap. My recommendation, you're going to ask me later, is if you're just signing out, you start with high cap, you get all the information, you go online, and then you talk to somebody like her and get personal, detailed information about your personal situation. I got caught off surprise. When I was talking to high cap, I said, I'm healthy. I don't need that secondary. I'll get the secondary, when something happens. And they're like, nope. Then it's too late. It's an insurance. You don't wait until you wreck the car to insure the car, okay? It's insurance. So even I was taken by surprise by a few of the details. So things, back to the original question, not being covered that one would think would naturally be covered, and medications. A lot of nuances around the medications. The whole Part D situation. So there's Medicare, there's Advantage, there's PPOs, I can see why you have a job, okay? There's supplementary plans, there's Medicare Part D, and I've done this for a while, and I spent a lot of time researching last year when I turned 65 to make sure I got, the appropriate coverage for me. So I want to tell a quick story, if I may. There's a gentleman that I'm working with right now. He has a traditional Medicare, and he has a VA TRICARE supplementary, secondary, and then no, I don't think he has Part D. I think TRICARE pays for that. But anyway, he developed a back problem, lots of pain. We went to a pain specialist. He recommended ablation. He agreed. We checked with the dog. Yep, it's covered. All right. He goes in for the ablation treatment. Month or two later, he gets this bill for $1,100. And we were told that traditional Medicare paid for it, but his VA plan did not. And it never occurred to me to check with the VA plan, because my understanding was that if you have a supplement or a secondary plan, they pick up the 20%. Whatever Medicare pays for, they pick up the other 20. And I learned the hard way that that's not always the case, depending on your plan. Also, sorry, another quick story. Another client, well, I'll just generalize this. Overactive bladder and other bladder problems can be an issue as we get older for a lot of people. It's the common prescriptions, the common approach after lifestyle behavior modifications is medication. The first line of medications that are prescribed by doctors are the older ones that have side effects. One of the side effects which gets my attention is if the person has dementia or any kind of cognitive decline, or even just a healthy older brain, it can make things worse. It can create confusion or make the mild cognitive impairment or dementia worse. I just happened to know that because this is what I do. And I was sitting in the doctor's office. I said, no, we don't want those medications. We want the new ones. And the doctor said, okay. He was okay with that. He prescribed it, went to the insurance, and they said, no, you have to try these older medications first. Yeah. Otherwise, you're paying for this privately. And I believe it was like $500 a month. Yeah. So there's a lot to the Medicare and the various plans. And I just wanted to give you a couple of quick examples.
So what did he do?
We decided to try lifestyle changes, bedtime hygiene, drinking less during the day, less caffeinated drinks, or, so behavior modification. And he agreed. We talked about this. This is what I do. And he agreed that the burden of taking one of the older medications versus the benefit was too great. And that's a decision that we all make all the time about our health and everything else. Is the burden worth the benefit?
Did they happen to tell you how long he would have to be on the old?
For the rest of his life.
So at what point can you get the new medication?
Okay, thank you. Maybe I misunderstood your question. Okay,
yeah.
So if he started the old school ones and they were not effective, they did not treat the problem, and we had to document that it did not treat the problem, present it to the doctor presents it to Medicare, and Medicare decides, and then there's a whole appeal process if Medicare decides they're still not going to pay for it.
Oh my gosh.
How long did he have to take it?
He didn't. He decided that burden
What if he had to take it?
for the rest of his life.
No. How long would he have to be on the old before Medicare would consider,
Thank you.
yeah, moving to the new one?
We were told 2 or 3 months.
Okay, so that's good fake. Good fake handshake.
So you could fake it for 3 months, do your lifestyle instead, don't take the medication, and then go back and say no.
Not say that.
Yes, that's okay, I do. Yes, it's too bad.
Or get it, throw it away, and wait for you.
Okay, but that's just one example. That was just an example of how challenging it can be.
Yeah, the main point
Yes.
is that
That is called the step therapy, and that's when it's important to have an insurance agent to interfere, because we can work together with the doctor to speed the process.
oh, that's great
It
to know.
doesn't need to wait 3 months for that.
Okay, see,
That's
good. That's why we're a team. This is why we're a team, because all of us know a lot, but none of us know everything, and the world is changing constantly, and that's why working with a team. If you're not if you leave today without your team at least beginning to take some form, then call me and let me help you put a team together. And because you're going to need it. Okay. And if you don't know what the heck I'm talking about, just call me and we'll have coffee and I'll figure it out for you. We'll come up with a real simple little plan.
I share something related.
Well, when we're done, I'm going to have Sue. You know, I didn't get a chance to thank Sue yet. Thank you, Sue. Okay. So, how do you help clients with multiple health care providers? So they got a doctor and they got a heart surgeon, and you know, how do you help them navigate? I'm trying to find my question again. I'm sorry.
I stay involved. I usually make the appointments, I join the appointments, I take notes, and I provide a detailed summary about what was discussed and potential solutions or therapies that have been offered. And I provide that to the older adults, if appropriate, and their families. And then I'm not the decider. I provide the information, right? And I just, care coordination, I stay in love with it.
Okay, so you know who all the care providers are.
I do.
Okay, so what are the most common gaps in Medicare coverage that you run into that catches families off guard?
Yeah, I answered that. That was the share of costs that doesn't cover some medication.
Right, okay. So how do you help clients prepare financially and logistically for services that Medicare doesn't pay for?
So in the original assessment and care plan, which is very detailed, we review that, and that is included. I do not ask for detailed financial information, but I do ask for big numbers, like how much is available stocks and bonds and savings, and what do you think your property is worth? So I ask I don't want to know accounts. I don't want to know. I just want a number. And then there are tools online through various insurance companies where you can plug in information like, okay, maybe I think I'm going to need, if I'm recommending right now, I think you should have care 4 hours a day, every day. This is what it'll cost. That I know. This is what it'll cost. And so we put together like a spreadsheet saying, of course, no one knows the future. We don't know when we're going to need 4 or 12 or assisted living right? We don't know that. But it's an educated guess, and I provide that information. And then family, do with that what they will.
Okay, a lot of my my next questions you've already pretty much answered. Are there community or low-cost resources you often recommend to fill those gaps?
There's very few, but I will say, maybe you have something to add to this, is when the medications are an issue, there's Good RX and other similar discount plans. So I lead people in that direction. Also, if there's like a catastrophic thing, cancer or something big is going on, and your medication, your treatment is out of sight, crazy expensive, or maybe not even crazy, you can go to the pharmaceutical with the information from the doctor and ask for some sort of discount.
Yeah, I would. I mean, you want to add though? There are some companies that they are specialized to help people to sign up for patient assistance program. And also all the doctors, they can sign you up for that. You just need to talk to your doctor and say, is there any pharmaceutical program available for me? And the doctor will help you. Because if you go to those places that they can help, you need to go back to the doctor because he needs to sign that you need the medication.
Okay, and a lot of this stuff you can talk to people one-on-one about.
Correct, yes.
Okay, so if you could give every family one golden rule for navigating Medicare and their care needs, what would it be?
Well, I would say keep informed, as both of you said. Every year, look at it with it's changing in the various programs, including the medication, Medicare Part D, but all of it. Look at all of it. Talk to somebody like her and make informed decisions. And I also believe in automatic payments. I'm not going to scare you with all the stories of how people got sick and then lapsed on their payments and then lost services or had to pay for services that they would have otherwise had to pay for.
And so, last question. At what point in their lives should an older adult consider hiring a geriatric care manager?
Now. I mean, seriously, setting up an assessment and care plan, I do this all the time. Someone healthy, a little older, hires me. I look at their whole situation. I create the assessment and care plan. I have folks who they want me to check in with them quarterly or twice a year or annually. Like, let's just look at what's been going on in your life and your caregiving situation, your situation with your social support, right? All of the various factors and update it. And then I send them an updated addendum, if you will, to the original report. And that way I know what's going on. So when they end up in the hospital and I get the call, I'm educated about the current issues. So when I walk through the door, I can be effective.
Wonderful. Thank you. Thank you so much, Alex. I'd like to ask Sue Gibson. Yes, let's give them a big hand. I would like to ask, that's okay, I've got.
Oh, you got? Okay.
Oh, you're right. Yeah, no, I do need that. Sorry. Sue Gibson has SLG care, senior care, and she was kind enough. She's one of our sponsors, and our sponsors contribute financially so that we can continue to bring these workshops to you completely free of charge. And Sue graciously agreed today to be our greeter. So I wanted you to give her a big hand for helping us out so we didn't have mass chaos at the door today.
Thank you to Alec for helping.
Yeah. Sue, give them this is going to be pretty quick, but if you would just tell them a little bit about what you do and what Medicare covers in your world and what it doesn't, because people become very shocked very fast.
Yes.
In this type of a situation. So I've asked her to speak a little bit on that.
Thank you, Nancy. I just did want to tie what I do to the Medicare talk, and SLG Senior Care helps families find assisted living, memory care, and board and care facilities. My main focus here is SLO County, although I have connections. I'm a certified senior advisor, so I've got connections all throughout the U.S., so if anyone needs help anywhere, I can connect you with someone like me who does what I do. But people come to me all the time asking if Medicare covers these facilities. They do not. They are private pay, so Medicare does not cover. However, when you go into the facilities, in SLO County in particular, you can actually subscribe to one of the doctors that come into the facilities to take care of you, the primary care doctor, so that you don't have to go out to your own doctor. Dr. Griffith, Dr. Sainsbury, Dr. Bourne, there's a handful of them, Katie Colvert. They're fantastic. They are primary care doctors, almost with a kind of a specialty in geriatric medicine. And it makes it really convenient for you or whoever in your family is in the community to have the doctor come in on a weekly basis to see them, and they don't have to go out to the doctor, especially if someone's in a wheelchair and that type of thing. But the only thing I just wanted to mention is they do have to be on a PPO to participate with most of the doctors. I think Dr. Sainsbury's the only one where you can be on an HMO and participate in his services. And some of them also have concierge services.
Yes. So without getting too far into the weeds, I like to call them communities instead of facilities, because who wants to move to a facility, right? Mm-hmm. So, but there's some beautiful senior adult communities out there, and it starts at independent living and goes all the way, into assisted living, memory care, and then, of course, what most of us don't want to go to, but sometimes eventually have to, is nursing homes. Sue helps with all of that. But I get calls constantly from people that want to know which places will take Medicare. And unfortunately, I know in the 5 cities area, the only person, please speak up if I'm wrong, but the only one I know of that takes Medicare is Arroyo Grande Care Center. All the rest of them are completely private pay. And then in San Luis, who takes Medicare?
Well, I mean, if it's the 7 Compass facilities, skilled nursing facilities.
Yeah, but those are skilled nursing. Yeah.
Yeah, rehabs.
Yeah.
They all take Medicare
Yeah, that's
for
true.
short term. But really, there is no long-term care.
And I'm glad you brought that up
Yes.
because everybody says my Medicare will take care of it. It takes care of it for a maximum of
21 days for free,
21 days for free.
and then it's 20%
After that.
copay after that.
Yeah.
And really, you need Medi-Cal to have long-term care coverage in skilled nursing facilities. But in our county, there really are none
Yeah.
that are offering long-term care because
Just the Arroyo Grande Care Center.
yes,
So,
limited. I mean, probably a year wait list to get in there.
yeah, so that's the hard truth. You know, so you need to know that, and your kids need to know that because the phone calls I get all the time is my mom fell, she's in the hospital. They're releasing her on Friday, and I need a place where she can go. And I go, okay, what are your finances? Well, there was no money. I go, well, you know, social services or Arroyo Grande Care, and there's nothing left. There's nothing else out there. And it breaks my heart sometimes, but often actually, but it's just, that's the way it is. And hopefully some of our politicians are going to kind of stop being so full of themselves on either side of the fence and start concentrating on this population explosion we're having of older adults. The last baby boomer is going to turn 65 in a couple of years, and the government is completely, they're so busy fighting over this and that and stupid stuff, schoolyard stuff, and they are not taking care of their older adults. And so I hope I did that pretty well without choosing any political side, because politics, there's no room for it here. But we need to insist that our politicians start advocating for us. Okay, so Sue, thank you very much. Thank you. Okay, now I would also like to, again, put my sponsors up here on the screen. I am totally multitasking today, you guys, so please bear with me. Okay, let's see. Ta-da! Why isn't it working?
Does it work with the power button? Do you press it again to have it come on again?
Maybe.
Just one. I hear something.
Something's happening, everybody.
Yeah, like that's the only way.
Okay.
Is it going on?
It's coming on.
Okay. Well, hopefully it'll go on. I would like to thank all of our sponsors. We are always looking for new ones. If you know anyone who would like to sponsor Seacoast Seniors, Regenesis 360, which is an awesome place to build your bones, make your bones stronger. Santa Maria Terrace, which is a wonderful place in Santa Maria. We have our lovely Sue Gibson with SLG Senior Care. The Villages of San Luis Obispo, beautiful place to visit. Estate 360, who is handles our estate sales, and then Nancy Puder. I don't know if any of you know, but my day job is as a realtor. So I've been a realtor for 47 years. I'm a real estate broker. And the only thing I ask you, because we do promise that there will be absolutely no sales pitch at these workshops, but if you do like what I do and you appreciate us bringing these workshops to you and you do need to sell your home, we would really appreciate it if you would consider giving us a call, because it's nice to have some food with our meals once in a while. So we don't charge for any of our services except the real estate, of course. We help coordinate you with all of the professionals. We spend sometimes hours on the phone during the week, talking to people, talking adult kids off a ledge because mom just, is in the hospital and they have no idea what to do or what direction to take. And all of that we do from the goodness of our heart. It doesn't feel like work. It feels like it's my calling. But like I said, it's nice to have food with my meals. So if anybody wants to sell their house, let me know.
Might be questions. Is there any more questions? Or?
Oh, yeah, we're going to do that. Sue, you're so good about keeping me on track. Okay, we're going to have a quick Q&A, and it's going to be pretty quick. So if we don't get to you, don't worry. The speakers are going to be here, and you can come up and talk to them afterwards, all right?
Can you give us their phone numbers? Like, say, Annie, and have us...
Okay, that's a good idea. Annie, how do they contact you?
Vamos. Bom, mas nós vamos 805 essa aí.
Speak up, please.
Speak up.
Yeah, we have to turn the mic on.
805-268-4455. And I left some cards in the back here and in the front if you would like to have some, okay?
Okay, does anyone need that number repeated?
And get for...
Okay, thank you. And Annie will pick up. She's the one that goes directly to her. Okay, and Alex?
Did you need the number repeated?
No, I was just going to ask her. She said something about being a certified, was it, Medicare advisor?
So let me give you my number and then I'll give you the mic. How about that?
Let's hold that thought for a moment.
So Geriatric Care Management is 805-441-7550. And I will put some of my cards in the back, or you can ask me for them. Come up and talk to me.
And that goes directly to Alex, too. You don't have to go through a phone tree.
Now, Sue?
Okay.
Oh, Sue.
So,
Sure.
And Sue, what's your number?
415? Yeah.
415, leftover from San Francisco, 656-6869, and my brochure's at the back.
Great. Thank you. Thank you so much. And let's see. Oh, Q&A. Okay, we don't have too long, but we're going to take about 10 minutes for questions and answers. Let's start with Beth.
Annie, could you just go back to basics? What's the difference between an Advantage plan and a supplemental plan? Repeat the question.
Supplemental plans.
Okay, let's repeat the question first. Yeah. What's the difference between a Medicare Advantage and a supplement plan?
Okay, Medicare Advantage and supplemental plan. Okay. Supplemental plan, you are on original Medicare. So Medicare is going to cover 80%, and the supplemental is going to cover 20%. Medicare Advantage, you need to keep your Medicare, you need to keep paying for Part B, but you are not under Medicare anymore. You are under the private company's rules. Yes. So, for example, if you go to a doctor, if they ask you what plan you have, if you have supplemental, you say, I have Medicare and I have Blue Shield or HealthNet, whatever you have for supplemental. But if you have Advantage plan, you say, oh, I have Aetna, I have Humana. So then you say the name of the company. So that's the difference.
I know, it's confusing. I would say call her, take her for coffee, and
My office.
yeah, come to her office. I'm a coffee person. It's like, let's have coffee. Okay, right here.
Okay. So,
I know Medicare doesn't pay for everything, period. There's many things they do not cover.
No, that's true.
That means your supplemental doesn't cover it either, and that means you don't have coverage,
What's your question?
period. What are the big things Medicare doesn't cover no matter what?
Well, Medicare doesn't cover long-term care, doesn't cover vision, doesn't cover dental.
Dental.
And when it comes to doctors, providers, Medicare covers 80% and 20%. The one thing that Medicare doesn't cover at all is experimental procedures. So that if it's not approved by FDA, it's not covered.
Good. Right here.
You know, I look at Dr. Chen, who's an ophthalmologist, and Medicare covers her.
What's the question?
Well, it's not a question, it's just the information.
Okay, this is just questions. So you can talk to her.
But that isn't true that it doesn't cover some vision. Because when I see an ophthalmologist, it's covered by Medicare.
So, and mine is,
Current.
yeah.
When I say vision, it's the annual exam and glasses.
Yeah.
The medical condition in your eyes is covered by Medicare.
Yes.
My annual vision test, what they do, but that's an optometrist.
But do you have...
She does it. She does it.
Okay, so it's a little bit of a gray area again, and that's why you need to talk to an insurance agent. You're absolutely right. I just had cataract surgery. It was all covered through my Medicare. I got the corrective lens. I paid for that out of my own pocket. And you're right, I go to the optometrist. You know, I always give them my Medicare card no matter what. And then I just figure, you know, sometimes it happens, sometimes it doesn't. But it's kind of like, for lack of a better word, a crapshoot. You know, when you go with your Medicare card, just always have your Medicare card with you. Okay? How about right here?
Where can you find out what the different Advantage plans are available? I mean, I only hear of Aetna advertising on here. Are there other companies advertising Advantage plans?
So he's saying, how can he shop Medicare Advantage plans?
Okay, we have, San Luis Obispo offers more than Santa Barbara. We have Aetna, Humana, United Healthcare, Alignment, and Blue Shield. Those are the ones that they have in the area. For PPO plans, we have only Aetna and United Healthcare.
Okay, next question.
Well, I was just going to add, you can also go to Medicare.gov.
Yeah.
Yes, you can always go to Medicare.gov. Thank you.
Yeah.
Right here.
I wanted to ask her what's the difference in care management and yours? Because my doctor offered me care management and Medicare PACE course. A nurse calls once a month if I have any issues.
Okay, that's completely different. She wants to know what's the difference between, like, you know, when you go to the doctors and something's going on and they want to assign you some care management. She wants to know what's the difference between that and what Alex does.
Okay, thanks. So yes, some doctors' offices offer their own care managers, and they only manage what's going on in that doctor's office. And I do everything. That's the big difference.
Yeah. Okay. All the way in the back.
Well, what happens when they change, you know, if they've been covering a drug and then all of a sudden it'll go up $50 in the middle of a year?
What happens if the drug was covered and it goes up, the price of the drug goes up during the year?
That's when open enrollment, the annual enrollment, the open enrollment that they advertise comes. That's why it's important, because they change the formulary every year. And sometimes they can change it. They do not show you that they are allowed to change prices along the year. And that comes GoodRx, the pharmaceutical programs, or the Canada. So I need to have options if something like that happens.
So basically you have to suck it up and pay it, go without your medication, but be sure and get your insurance reviewed, during enrollment period. Yes, back there.
I have a couple of questions.
One question is what you get.
I've been waiting on.
Okay, that's all right. They're going to be here, so we're not going to send you away without your question answered.
All right. Give your private insurance for your first retired, and you get that advice, and you don't get Medicare 10 years later, you need Medicare, then you cannot, are you saying you cannot get it?
Okay, that's a good question. So she's saying if she decided not to do Medicare and decided to go private pay insurance back in the beginning, and 10 years later she discovers she made a big mistake and wants to, sign up for Medicare, is she allowed to do it?
Yes. You have the period of January to March 31st to apply, and your plan is going to start in July 1st. So every year they opens up for you. Yeah.
Oh, January
through March, and unfortunately you're going to have to pay some penalty, and it's a lifetime penalty. Yes, it's 10% over the premium.
10% over the premium, but you really need to talk to her one-on-one. What's your other question, hon?
What was the old meds that give you dementia? And what are the new?
Oh, do you want to talk about that from the front of the room? Or do you want to talk privately about that?
Well, we can certainly talk privately. There's a list. I'm going to give you a basic answer. There's a list. It's called BEERS, B-E-E-R-S. Invented by Dr. Beers and a group of scientists, and it's on a scale. So it tells you these medications, they rate it 1, 2, or 3. These medications are a 1, which means you should be aware. And then 2 is kind of likely this is going to cause you problems. Again, you're always, no matter what you take, you're always looking for side effects, right? Mm-hmm. And then 3, it's like, non-recommended. And then you look at all your medications and you add up the total, and it will tell you, what kind of danger zone, if so to speak, that you might be in.
Wow,
that's a conversation with a doctor.
Is that beers.org?
It might be .org. I'll let you Google beers.
Yeah.
Beers list. Yeah.
Okay. So I think I forgot to repeat that question, but she wanted to know which medications are the ones that we should steer away from. And that's good information, Alice. Thank you. Is that me making the squeal, or is that you? I think it's you, because it only happens when you stand up. Okay. All right. One more question, and then remember they're going to be here afterwards.
I just wondered, Alex, what your fee structure is for like an assessment, home assessment.
Do you want to talk about your fee structure?
Sure.
Okay.
He's asking.
He wants to know what she charges.
So it's for a full assessment and care plan and a professional report and a review, which takes me a few weeks. It's $1,000, and then I charge $100 an hour after that.
And keep in mind, that only kicks in as needed. So if you don't need to talk to her for 6 months, the meter's not running.
That's correct.
Yeah. Okay, good. So in the scope of things that might sound like a lot now, 5 years from now, you might be calling me and saying, who is that person? Because it'll seem like a bargain. Mm-hmm. So I think we're going to do our raffle. So Sue, if you would bring up the and choose the, there it is.
Dookie. We have some gifts.
Okay, let me get the first gift. I always forget to tell you this. This is a nice book and guide called Downsizing Made Easy. And if you invite me to your home, you get this for free. And it's wonderful. Step by step on how to downsize.
Thank you. 3. Yes.
Okay, Sue brought this raffle. It's a 2-part raffle gift, and I've only got 2 arms.
They're 2 bits.
Yeah. So Sue brought this really cute silicone ice pop mold.
Yeah.
Make you feel like a kid.
Still summer out there, so I'm prolonging summer.
And a little water bottle. So who's the lucky winner?
It is number 175-1252.
Woo! All the way in the back. All the way in the back. Would you? Thank you.
The Alzheimer's water bottle. I co-chair in the Alzheimer's Walk, which is on November 8th this year. I hope you'll join us.
We're all going to be walking for Alzheimer's in November, right?
And September 16th, we've got a kickoff party in Slow at Woodstock, so come and join us.
Call me. I'll tell you what's going on.
Yep,
okay.
Exactly.
Our next gift is C's Candy. I've been scrounging for raffle gifts lately, so I figure you can't go wrong with C's Candy assorted chocolates. And who is the winner?
175-1286.
Here's what does mean.
Woo! Another winner. Right over here. Oh, thank you. Yeah. Okay, and last but not least, we've got a box of cookies from Crumbles. Who's been to Crumbles before? They're kind of wild and crazy, so I tried to keep it as tame as possible, but it is an experience to have a box of Crumbles cookies. So, who's our lucky winner?
Now I wish I was in the raffle. Darn. 175-1258.
Woo, right here. I love Crumbles. Congratulations. There you go. Okay. Oh, and did anybody come with a full with all their holes punched on their learning card?
Gentleman did, but he left.
Besides, Bob.
Yep.
Oh, yeah. Okay. So Bob Dunn got a $10 Panera card today. I'll give it to him later. Oh, is he still there? Here. So, thank you. I gotta remind myself to go get some more of these.
Okay, I'll get cards.
Okay. Remember our seminar on Wednesday morning, September 24th, Downsizing Made Easy. Bring a friend. We don't really advertise. We don't really have the funds to advertise, so there was no ad in the paper this time. But we like to, when we can, when it's in the budget, to advertise. So we depend heavily on you to, spread the word that this is a safe place to come and nobody's going to try to sell you anything. What else? Thank you again for our sponsors. Thank you again for our wonderful speakers. Thank you to Sue Gibson for greeting today. Thank you to all of you for coming. I appreciate you so much.
Thank you. Thank you, Nancy.